Good morning, everybody. My name is Dr. Nick. I'm here at Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm here with our lovely CA Mike.
How's it going, everybody?
Mike has a doozy today. He's got a history of some back pain, more specifically from a herniated disc, I do believe. So we were just chatting a little bit beforehand. A little bit of Mike's history is he's always been big into lifting. You did powerlifting, or?
A little bit of powerlifting back in college and back in my time in Florida. Basically just had finished a heavy leg day. Kind of came home, I was younger, so didn't do a whole lot of the mobilization, stretching, everything that you should be doing after a heavy lift, and ultimately was just bent over cleaning in a really good posture form. And when I went back up, immediately felt pain going up the low back, going down both legs, got imaging shortly after, herniation in the lumbar spine. I think it was L4-L5 level, but basically that was the start of my college career, so couldn't have back-to-back classes. If I was seated for, I think, like longer than an hour, it was just not going to happen for me. The rest of the day was ruined, so yeah, it was definitely a little bit of trouble for a good little bit of time.
Yeah, humbling experience for what, 19, 20-year-old?
Exactly, yep, 19, 20, now even going into my 30s, it'll still fire up here and there just because the general damage that's been done.
Yeah, so Mike is very athletic in nature, so he's very cognizant of his body, how he moves his body, even more so now after the incident. But, life happens and things happen and, pain comes back on occasion. So Mike's currently getting just a little bit of a flare-up from that herniation right now. So we're gonna treat him and hopefully get him feeling a lot better. So I'm gonna have you start off like on your stomach first.
Perfect.
And when you say heavy, what were you squatting?
Well, I don't know, numbers at the time, but in that ballpark time frame, I was squatting around a 385, deadlifting about a 445, 465. So pretty heavy numbers, pretty substantial.
Pretty significant for sure.
When you're talking 190 pounds, that's
Is that how much you weighed?
Yeah.
Dense. Gotta let those shoulders drop.
Yep.
I'm always learning something new with Mike too. Power lifter, he was telling me beforehand what he was cleaning was his poison dart frog.
Yep.
What would you call that? It's not like an aquarium, that's
no, it's a terrarium.
Yep. Yeah, a terrarium.
Yeah, those are fun setups too, because you have to have really high humidity, but you also have to monitor how much water you're putting in the tank itself, and it was a pretty cool little project.
A little pressure through here first. Take a breath in and out.
Yeah, definitely the pain with the frogs was with feeding them. So you had to have hundreds of wingless fruit flies to feed them.
Oh yeah. Take a breath in and out. Those and like those little gnats you get from potting soil are like my nemesis at home.
Yep.
They're so annoying. I want you to lay on your left side first, so facing me this way.
Got it.
And right there. Good. Little pressure. Let that hip roll towards me. Good. Good. Other side.
Oh, that was a good one there too.
That was. For being as sturdy and as strong as Mike is, he moves like butter, which is a good thing. Same thing, let that pressure. Right there. Good. Going back.
20-year-old Michael might not have done his mobilization, but 30-year-old Michael does.
Goes to show you it's never too late to get on top of things.
Oh yeah.
Little pull. Good. Same thing. Good. So what we're going to do with Mike as far as treatment outside the adjustment is we're going to do some focused shockwave on him. We're going to follow that up with laser, and then of course we're going to do some corrective exercises. Warm up with some level of McKenzie. We'll audit him. We'll see which direction he prefers most with the McKenzie, and then you know, we'll implement it. Mike doesn't like dry needling. I would do dry needling in this case, but he responds so much more better with focused shockwave. So of course we're going to use focused shockwave to help him feel a little bit better. So we're going to jump to that next.
All right, we'll see you guys there. All right, everybody, back with part 2 of the video. In the previous video, Dr. Nick gave me an adjustment to help the vertebrae, help the joints move around a little bit more. Already feeling a little bit of relief in the back. If you didn't see the first part, just going through a little bit of a lumbar herniation flare-up from college. So we of course have our focused shockwave machine. It's also important to note if insurance doesn't cover focused shockwave for you, dry needling would be a very good supplement as well. I prefer the focused shockwave in my case. I have gotten dry needles in the hamstring in the past. I'm sure you've also probably seen that video because all of our viewers see all of our videos, of course. So have gotten dry needles in the past, but honestly I just respond a little bit better to focused shockwave. I prefer it. It's not as long of a modality either. So we're gonna go ahead and knock that out. We'll do our focused shockwave, we'll bring in the laser, and then afterwards we're gonna go get some exercise and get some functional movement going. All right, without further ado, I will hand it off to Eddie, and Eddie's gonna take us away.
All right, Mike, let's have you on your stomach flat there. And go ahead and show me where it's really, really hurting you in your low back here.
So it's worse on the left side, and it's going to be like L4, L5, so it's roughly, right about here in this general vicinity.
Gotcha. All right, go ahead and put on some gel on you. Let's see here. Cool. All right.
A lot of people in the office actually ask, why don't we have gel warmers? And, we surprise them all the time with telling them we actually keep our gel in the fridge. We prefer that nice, really alerting cold sensation as the cold liquid drops on top of you. Don't wonder why we have the warmer. Wonder why your office doesn't have a fridge for the gel.
Mike, are you ready, sir?
I am. Doesn't seem like the machine was ready.
Yeah, right.
Yeah, so a little higher, like right in that area, but you can definitely turn it up a little.
Gotcha.
Yep. Oh, yeah, right there. You can probably turn it up just a hair too.
Gotcha.
Oh, yeah, that's good.
That's good.
That's right at the point where any higher I'd probably start to like clench my fist. So we're good. So Eddie just had a birthday this last weekend.
I did.
Tell us about it, Eddie.
Oh, I turned 29, and yeah, I'm definitely feeling the back aches and the neck, stiff neck there, but it's
is
all
that
good.
from old age or is that from the weekend?
We'll definitely say old age. Yeah.
Maybe we'll get you some treatment later on. We'll do
Birthday video?
Yeah, I guess so. Yeah.
It's necessary.
Oh, it's definitely necessary.
Oh yeah, that's a good spot.
Right here. Gotcha.
That's like almost traveling into my pelvis.
Jeez.
Yeah, that's a really good spot. You want to lower it just a tad bit?
Yeah.
Yeah, there we go. Yeah, and if we're thinking about what is a disc herniation, even though my disc herniation happened at this point 10 years ago, it still is going to be, that natural stenosis. The disc is going to be, just a little bit more broken down than every other disc that I have, talking in reference to the L4-L5 level. So, it's very normal when you have that kind of a history, not even a traumatic history, but you have that injury in your past. It's very normal to every so often get a flare-up. And again, you just have to think it's because the disc is a little more prone to that fluid-like substance that's inside of the disc to seep out. And that's just essentially what I've got going on right now. Just a little bit of a flare-up due to that stenosis, if you will, from the herniation. That's a little high.
A little high?
Yeah. That's like right on the disc.
Gotcha.
That just really woke it up. I was definitely right at that level though. So focus shockwave, like you can see, we can do it over bone, so we're kind of going right over the spine. It is not a super pleasant spot. It definitely catches my attention in a lot of different areas, but it's not going to be the same sensation as if we were to take the radial shockwave and do the radial shockwave over the spine. That would be actually a very painful sensation. It would essentially cause my whole spine to vibrate, and it would be very uncomfortable. But focus shockwave can go over the bones. It actually has a lot of good research on the beneficial values to going over bone fracture. Again, it's not going to be comfortable, it's not going to be pleasant, but there's a lot of really good research that shows the positive effects of it.
Still doing okay here?
Yep, still doing good.
Cool. Safety break.
Awesome. A lot of people don't actually know, but if you've ever seen any of the treatment videos of Dr. Brady in the past, this is the exact same spot that Dr. Brady also gets his treatment on. Dr. Brady's disc herniation was also at a L4-L5 level, and his symptoms are normally worse on the left side as well. So, Eddie, I think you've done it before, but you're now doing the Dr. Brady Shockwave special right now.
Oh yeah, This is kind of very, very similar to what Dr. Brady has, and yeah, he was definitely flaring up this one day and found a lot of good spots on him.
Oh yeah, and you get a good spot once the toes start curling up.
Yeah.
I'm sure the viewers have seen my feet are moving around quite a little bit.
Yeah.
The focus shockwave is it's a very, very, very unique feeling. It's definitely something that I would recommend everybody try at least one time. Now, obviously, it's not something that you want to try if you don't have any pains or aches going on, because it feels entirely different when you do have a flare-up or you do have, a tendinopathy or some sort of, musculoskeletal condition going on. But it's definitely something that you want to experience at least once. It's such a unique sensation. I mean, when you go over a problem spot, it catches every inch of your attention.
Feel anything over here?
Oh yeah.
Gotcha.
Yeah, that whole area is definitely lighting up. Now I will say, as a shameless plug-in, here in the office we will eventually have a workshop or an open house for the Shockwave, so that way, we can get some people in and get some ideas flowing. But we are going to have, on the 22nd of February, a open house for laser, and we'll talk about that a little bit more as we do the laser section of this video. But just know, if you have never experienced the Class 4 laser before, and you'd like to learn a little bit about it, or maybe even see it in action, we will have that going on. Not this Saturday, but next Saturday, probably right around the time this video gets posted, or maybe a little bit afterwards. But just know we do host open houses in the office, just for the sole purpose of kind of spreading knowledge about our modalities. So make sure you send us a message, like, comment, you know, get the information. We'll be happy to share it with you.
Everybody enjoyed the Super Bowl yesterday?
And I would even add in, again, we're doing a laser open house. We want to have a focused shockwave open house, but if there's anything that you guys would like to see us host modality-wise in an open house to come, feel free to let us know. You know, even if you want to get some information on ultrasound, or even just our functional strength program with corrective exercises. You know, we do it for the community, so if we see the interest, we'll definitely host it.
All right.
So
That was our focused shockwave. Like I said, next section we're gonna do our class 4 laser, so we'll see you there. All right, part 3, guys. So we've been treating a old lumbar disc herniation. First part of the video, we had Dr. Nick give me an adjustment. Second part of the video, we did some focused shockwave. Important to note, if this was, you know, a patient's treatment, we would have kind of verged either from focused shockwave or dry needling, just depending on finances, insurance situation, etc. So just know both of those are really good supplementary modalities for this specific injury. Next, we have the laser coming up, just to kind of decrease that inflammatory process that we just started with the focused shockwave. Obviously, you know, with the back not moving as well as it should, a little bit of inflammation set in from that as well. So laser is going to be a nice kind of 1-2 punch, if you will. And again, if you missed the shameless plug that I did during Focus Shockwave, we are now hosting here in the office on Saturdays, not every Saturday, so make sure you comment, send us a message to figure out the schedule, but we are doing open house workshops or surrounding our modalities. Coming up on the 22nd of this month, that's February, depending on when this video gets posted, we will have an open house for laser. In the future, we plan to have an open house for shockwave, but it does not stop there. We can do any modality, we can do exercises, etc. Anything really that the community wants. So make sure that you comment, send us a message, let us know what you want to see, what you want to learn more about, and we'll make sure to host those things. But without further ado, we'll hand it over to Eddie. We'll get started. All right, so since we're going to go into the low back here, we're going to go expose a little bit of the low back here so we can get easy access right here. And then we're going to go into the left quadrant of the low back here. We're going to go boom.
So again, if we're talking, you know, broad picture, what can we look for modality-wise? Another supplement that would be nice for laser, and nothing really works quite as well as laser for this specific instance, but another complement that would be nice, or something that we could do instead, a supplementary modality, if you will, would be heat and stim, or even ice and stim, depending on the severity of the flare-up and depending on how acute the injury is itself. Either one of those would be nice, either to, again, decrease the pain, which would be cold, or to get the body moving a little bit easier, which would be the heat itself. Because you have to remember, when we put ice on any muscle, it's going to get a little bit more stiff. when things are colder, when molecules or when particles cool down, they don't want to move as fast as they do when they're warm. Now that's talking cellular level, particle level, includes and even carries into the muscles itself. So heat is always nice once you've gotten rid of the pain, but doing a little cold and stim can definitely help in this situation as well if the patient is just guarding and is in a lot of pain from muscle spasms, etc. But again, both are really nice supplementary modalities to the laser itself.
Mike, how's the heat? Not too hot?
Oh, it's perfect.
Good.
I think one of the coolest kind of fun facts, if you will, about the Class 4 laser, and you guys, the viewers, have probably heard me say this before, but Class 4 lasers are actually used quite often in vets' offices, just because, one, of how effective it is with decreasing muscle spasms, with decreasing inflammation, but it's also very, 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 very effective in the world of veterinary offices at delivering a treatment that is not going to stress out the pet at all. Because, it's a modality that's very similar to something they're used to, which would be a warm pet in this situation. So, we're not having to try to tie down a dog and stick needles into them. We're doing something that's very similar to what they're used to. It's going to keep them from, getting further stressed out, getting further anxious, but it is very commonly used in vets' offices, which is, like I said, kind of a fun little fun fact that not a lot of people are aware of. So that was the laser part of our video. We're going to go ahead and get this all cleared out. We're going to go over to the exercise floor. We're going to do some of those low back McKenzies, get a little bit of functional movement into the lumbar spine, and that will conclude all of our treatment. So we will see you guys over there. All right, everybody, the final section of our video. We just got some great advice from our exercise floor Jordan over there. I don't think we can see him anymore, but he gave us a little bit of a rundown on the McKenzies. So I'm going to go ahead and do them, and I'm going to talk you guys through them as well. So we're going to go ahead and start off with our McKenzie 5, as we like to call them in the office. That's over the bar. We also have the variation that you maybe have seen me do a video on before, which is where we're just using our hands as guidance. But if we have the bar is a little bit better, so we're just going to crank out a couple reps of these. Now, it's important to note when we're doing these, we want to stand with a nice tall posture. We're going to take a deep breath, and as we exhale, we're just going to lean ever so slightly back. And again, we're going to take one more deep breath, exhale one more time, and ooh, that's where I start to lock out right there. So I'm going to go ahead and lean forward. I'm going to speed up everything now to do actual pace now that we've kind of seen that motion. But my end goal is to basically get a little bit farther than where we just were, which was right there. So maybe after about 20 to 30, we're going to kind of look at that motion, see if it's getting a little bit easier. But that's the goal for today's movements. And really, that's what we're going to be always trying to do, especially during a flare-up like this. I'm going to try not to talk as much so I can get through the regular speed, but anytime we're going through this kind of a flare-up, we want to increase that motion without overstressing the joint. And that's going to be really, really, really important for us to just get that repetitive motion. That was a perfect rep right there, and then just reset ourselves. So a little bit of an inhale, exhale, a little bit more.
and then back up. So again, we're gonna do about 20 to 30 of these. I can already feel it starting to get a little bit easier. So maybe in about 10, we'll move over to the floor and we'll start to do the press up variation of it. And it's important to note too, depending on your flare up, depending on how severe your pain is, how acute your pain is, you might be able to one day do from the floor, and then the next day you might resort back to the bar or back to that hand placement. That's totally normal. We just want to get the highest level of resistance that we can without too much pain. So obviously using our body weight is going to be a little bit more resistance than here, but we're going to try to warm ourselves up to get to that point. And I'm already starting to feel pretty good. You can tell I've got a little bit more range of motion there before I start to feel that slight pinch that you kind of saw towards the end of that. So let's go ahead and go over to the floor now, and we'll change our motion just a little bit. So again, this is going to be a little bit more resistance because we're using our entire body weight here. And there's Jordan over there, the mastermind that gave us all these great ideas. Thanks again for the help, Jordan. All right, so we have our push-ups, or press-ups, excuse me. So important to note, it's a little bit different now. We're gonna be cueing from the hips, so we wanna really push the hips into the ground. And same exact thing, take that deep breath, press up. And once we get that full extension, we're just gonna come back down. And that was a perfect rep. I like to every single time reset my hips just to make sure we don't start to pick them up off of the ground like so. So get those hips into the ground. That nice exhale. It's always important to do the proper breathing and back down. Hips. And we want to keep the hips pressed against the ground just so that way we don't try to extend the low back to cheat this movement. You can kind of see I picked my hips up and I get a little bit more movement, but it's unnecessary movement. It's just going to end up pinching the low back a little too much. So just drive those hips into the ground and press up. And you can see these movements are actually going really well for me. In conjunction with the Shockwave, the laser, the adjustment itself, things have honestly calmed down pretty good. I still get right there a little bit of a pinch, but overall it's moving a lot better. Don't even really have that primary left-sided pain anymore. It's kind of resorted more to right being focal, which is again exactly what we're looking for. Radiating symptoms, we want them to localize a little bit more, so the fact that everything's feeling a little bit more focal is exactly what we're looking for. So I'm gonna go ahead and do like maybe 10, 15 more of these throughout the day. I'm gonna do about 40 to 50 just to really get myself out of this flare-up, but ultimately that's what treatment for a kind of a outdated lumbar disc herniation would be, or just any sort of low back flare-up. This is what it would look like in the office. But all right guys, Mike got the exercise floor, got Dale with me. We'll see y'all next time.